Yeah, so some of the challenges the navigators sometimes face here in the United States and perhaps in other countries, and that's from my experience working at Dana-Farber for quite a while, is that now is not a new concept anymore, right? Now patient navigation is part of our healthcare system. It took almost 15 years to realize that and to understand and implement it. However, some of the challenges we still face, especially for non-clinical navigators like me, versus nurses, navigators, and social workers navigators, sometimes is complicated inside of the institution because staff, sometimes they don't understand our role. Patients think that we are social workers. Social workers think that our role is overlapped with their role. And also, sometimes can be a little bit territorial from those roles I mentioned before. Also, providers. It took us a long time to educate providers about our role and what capacity we have to help patients and how we become part of the team. And of course, now I can say that from my experience at Dana-Farber, that now navigation is completely involved and implemented, but it took us some time. On the other hand, in Guatemala, because it's a new concept, right now we are working with a couple faculty members at the hospital in Guatemala, Dr. Sergio Ralón and Dr. Patricia Chacon, for them to understand, because now they have questions, oh, that sounds like a social worker. It is like a psychology support also. What is this? And navigators are asking also, Nancy, people are asking if we are, again, social workers or if we have different training. Education is a key to succeed. So for us, it took us a lot of time to educate all the staff to understand. But navigation starts at the front desk of your clinic. It is not just one person. Navigation is the secretary, the person who coordinates appointments, is the social worker, is the medical assistant, the fellow, and the doctor. Why? Because each of them can track some barriers. So for example, in our clinic at Brigham and Women's, the secretary of the staff members, when they are booking appointments, and they hear somebody saying, oh, I don't have transportation, I need to cancel. Wait a minute, we have a navigator to help you. When the doctor listens, oh, this hospital is so far away to follow up appointments. Like, okay, we can deal with that. We have a person who can help you. So again, I think still we are facing that issue in several organizations, local and international, but education is the key.
I must really support what you have said there because we find something very similar. And it's really education, education, education. It is such a new concept for us. Navigation is not part of the healthcare system in South Africa as yet. It is not recognized as a speciality as yet. We have the doctors that have got experience from overseas. Overseas, remember, is here. and they have come up against navigators, and they've been wonderful ambassadors for us. Some of our nursing staff that have got international exposure have heard about navigators. But largely, we have done literature reviews. We have read the Aon books. We have attended Aon conferences, or some of us have. We're on the telephone in telecoms trying to learn from you, trying to work out what we can take, what we need to leave behind, and perhaps what we can share with you as well, ultimately, that we have found in our experience that going forward as a community of navigators, and it's an international community of navigators, that we can use for our patients. That's exciting.